Assalamu alaikum student. Today we are going to study about the inhibitors of renin angiotensin system. Angiotensin converting enzymes inhibitors or angiotensin 2 receptor blockers, they are commonly used in the treatment of hypertension. Angiotensin converting enzymes inhibitor includes lasopril, enalapril and benzapril. They are used in the arterial hypertension, diabetes mellitus and heart failure where reduce injection frictions and myocardial infections. Angiotensin converting enzymes inhibitors are the drug that inhibit ACE and decrease the blood pressure by decreasing the conversions of angiotensin 1 to angiotensin 2, decrease the secretions of aldosterone and by decreasing the breakdown of bradykinin. They are also increase the renin secretion, increasing the angiotensin 1, decrease the proteinuria and preload and afterload. Most common side effect of this angiotensin are the dry cough that is due to the increase of bradykinin concentration. So, ARBCs are the second night treatment options if ACE inhibitor are not tolerate. They are cause inhibitions of 81 receptors and decrease the vasoconstriction, secretions of aldosterone, proteinuria, and cardio remodeling after acute MI. So, ARBCs are also cause angioanemia and hyperemia, and it is cause the direct renin inhibitors. That is reduce arterial hypertension if both inhibitors and ARBCs are not tolerate but associated with the side effect like rashes and diarrhea. So it was all about inhibitors of renin angiotensin system. Allah Hafiz.